We want to focus the majority of our time here on physicians' age management. This is relatively new here in the high country. This is not necessarily that new across the country, but so exciting to people as we age. And we all seem to do that, don't we?
Well, it's unavoidable, and one of the myths that I like to get right out on the table is that this is anti-aging medicine. It is not possible with the science available to stop aging. However, the science is very strong that we can actually slow aging substantially, and it's not really that difficult.
Well, it's about looks, but it's also about quality of life, how you feel.
Correct. Yeah. What I'm after is I really assess patients very precisely and very extensively. So a workup they get if they're a patient in the practice in physician's age management is much more extensive than what they get for a general annual physical exam. It takes about 3 weeks from the time we start testing a patient until I actually sit down and review, and I use a team approach. I have a exercise and nutrition consultant who's an expert in her field. I have a doctor of pharmacology who's an expert on natural medicines and hormone supplementation, and then of course I kind of steer the ship and monitor the patients. And so once all that data is together, we really can put together a very solid program for a patient that really leads them forward with the best chances of more healthy aging.
So we're all aging every day, but how do we know when we're getting to the point where your age management program can help?
Well, typically patients that are in tune with their body start noticing things, and myself included. What I notice first and what many patients complain about is a loss of energy, just the inability to get through the day with the fortitude they need. And that becomes very prominent, and people notice it, and that's something we definitely help with the program. Loss of sleep, quality of sleep, people stop sleeping as well. Sleep is critical for healthy aging, and that's something we address and can improve upon quite a bit. Belly fat, not everybody is hugely obese, but as we age, it's very typical, 10 pounds of weight gain each decade of life, and typically it's around the middle, which unfortunately is the worst place to be. So even if you have that little, I call it a bump, and if it's starting to show up, that's really a sign that things are not going in the right direction. And then sexual function, desire for sex, very common to decline, and it's not something that's a main focus of the program, obviously, but it's something that I call a nice, healthy side effect that when we treat patients, they get better in that arena as well.
So if you're filling a Viagra prescription every month, you probably could use some help.
Absolutely. Well, and the reality is, and I talk to my patients quite a bit, there's so many depression medicines, anxiety medicines, sexual aid medications that really aren't necessary. And people in my program understand that, and a lot of patients are able to come off those medications, including things like heart medications, hypertensive medications, diabetes. We consistently can pull people away from those things, and a lot of times pull them off those medications.
So why, when we go to our general practitioner, why are they not able to help?
Well, that's an interesting question, Tim. I think the main thing is I went and did extra training. I didn't learn this in medical school, did not learn it in residency. It was still very much in its infancy at that stage, but about a decade ago, I took a keen interest in it, started reading on the subject, and went to several meetings. And the reality is there's wonderful science out there that most physicians are not exposed to unless they take the time out of their schedule, busy schedules, to take time to learn this. And that's exactly what I've done. I've accumulated hundreds of hours studying this field, and I feel like a true expert now, and that's the way I want my patients to be handled.
Hormone optimization is a part of your program.
Correct.
There's been some studies released recently on possibly some negative effects of hormone replacement. Talk about that a little bit.
Oh, absolutely. And what I like to say is those are half truths. And the flaws in the studies were they were done with what are called non-bioidentical hormones, meaning hormones that are produced to be similar to what our own bodies produce, but not identical. And when you look at smaller studies, granted not as big, but when you look at smaller studies, with bioidentical, meaning still produced in the laboratory, but produced to be identical to what you and I and what a woman produces, you do not see the same bump in heart disease, strokes, cancer. In fact, you see just the opposite, a reduction in those. So I think it was faulty as a blanket statement to say women in particular should not take hormones unless absolutely necessary. That's leading to many things that's just going to make their quality of life decline and aging accelerate rather than keeping it in check. The data is very clear that if you use the proper hormones and monitor them, which is what I do with every patient, to keep them in what I call the sweet spot, patients age more gracefully, they feel better, and again, all these good side effects. They lose their belly fat, they get far away from heart disease, high blood pressure, stroke risk, dementia risk, cancer risk. All those things decline, and they get the healthy side effect also of better sexual libido function. Physically, they like what they see in the mirror.